I am a practicing cardiothoracic surgeon now based in Malaysia. Following my school education, I went to England to the University of Cambridge to do my medical degree. And following that, I continued training in England, in UK, and also in the United States, where I was an advanced clinical fellow in Cleveland Clinic and Mayo Clinic. And then after that, I returned to Malaysia, my home country, to start practicing initially in the government hospital, but now in the private sector, based and now in Kuala Lumpur. A lot of studies have demonstrated that Mediterranean diet can be quite protective compared to our typical Western diet, right? Now, so when you compare the Mediterranean diet with the typical American or European diet, apart from the Mediterranean diet, there is a lot of evidence, clinical evidence, that the Mediterranean diet is protective. Right? So the studies that have been done on people who have survived heart attacks and so on have shown quite convincingly that people who follow the Mediterranean diet have lower incidence of recurrent heart disease and recurrent heart attack, right? And not only that, the incidence of other comorbidities, including high blood pressure and obesity and diabetes and so on, all improve, right? But the Mediterranean diet is quite complex, and there will be the intake of oil and fibers and meat and so on. So it is like difficult to pinpoint what really is the single most important item, in the Mediterranean diet. Now, if you go back a little bit and look at the China study, Colin Campbell initiated this China study and looking at various different cultures around the world, different countries. So they found that certain populations, for instance, in certain parts of China and so on, the incidence of heart disease is lower, right? And when they analyze very carefully, it seems to be the consumption of different food, especially with vegetables and fruits and so on, right? So that's why the conclusion from there is that the plant-based diet is healthy, right? So now coming back to the Mediterranean diet, there is a large proportion of vegetables and fruits and so on, and also the oil part now, which is my special interest really. Now, in the Mediterranean diet, most of the oil would be olive oil, right? Now, we know that olive oil is high in monounsaturated fat, right? So my feeling, and I've been talking about this thing for quite a long time now, that oil is the most important factor in our diet, right? In terms of heart disease and other degenerative diseases, including diabetes and hypertension and so on, right? Now, so when we compare the Mediterranean diet with the typical American diet, the oil part is very different, So, okay, now let's consider just the oil part. So the Mediterranean diet has high monounsaturated fat content in terms of the olive oil we consume, right? And then look at the American diet, it is more in terms of saturated fat and polyunsaturated fat, right? Now, so this is where the oil part comes in. Now, permit me to go in a little bit of the basic knowledge about this oil business, and that's why I think that it is the most important part in our effort to reduce the cardiovascular disease around the world. As you mentioned earlier, cardiovascular disease is still the major killer in most countries around the world, not only in the developed world, but also in developing countries now, right? So my feeling is that it is the oil that's the basic problem. Unfortunately, because our misconception about cholesterol and misunderstanding about cholesterol and the associated saturated fat, we have deviated from what really is important, you see. Now, so most people would think that cholesterol is a major issue, right? So, in the Mediterranean diet, typically the consumption of cholesterol is relatively low compared to the typical Western diet, because the meat consumption and other parts like eggs and so on would be a little bit lower in proportion. Now, when we look at the cholesterol, and most people would accept, most doctors would accept that if your level of cholesterol in the blood is high, the risk of getting heart disease and so on would be higher, and stroke, say, which is just a manifestation of the same thing. So, and this stems from the original research and study into the origin of coronary heart disease, right? So when we look at what we call this atherosclerotic plaque, the yellowish plaque that we see, I see this all the time during surgery and so on, right? That certainly there's a lot of cholesterol in that plaque, and that's why we call it cholesterol plaque, right? Now, the effort to reduce the cholesterol in the diet through diet, exercise, and even with drugs like the cholesterol-lowering drugs, the statin, would reduce the cholesterol. So this is where I feel that whether we're thinking about the Mediterranean diet, or even the plant-based diet, which nowadays a lot of people accept that this is the healthiest diet, the oil part is the most fundamental thing we have to think about. There have been a lot of studies on different kinds of fasting, right? So in terms of calorie restriction, that we, just an overall calorie intake. Right? Maybe, as I said earlier, that we have to pay attention mostly to the fat, the oil, right? But overall, if they can be, but most people nowadays they're overweight or obese, right? And we don't get to be this state taking healthy food, right? So a lot of times, when we all consume, they're consuming a lot of good stuff and bad stuff, right? But just purely looking at the calorie intake, can be carbohydrate, or meat, protein, or fat. So eventually it boils down to the same thing. So we all store it as fat, right? As I said earlier. So when somebody is overweight, then all these other things comes about, right? All these diseases, including heart disease, right? So they're all part and parcel of the same problem. Right? So in terms of reducing the calorie intake, so calorie restriction, right? People have different forms of fasting, and there's one that is seems to be quite effective. It's called intermittent fasting. There's different patterns of it, but it still boils down to reducing the amount of calorie that we take in our food. Right? So now, if we just say that reducing just the carbohydrate, right, and this is what ketogenic diet is about, right? In this kind of calorie restriction, not really, but just reducing the sugar part has an influence, of course, on the overall health of our body, because the carbohydrate part, the sugar affects our insulin hormone response. Right? So we know that insulin is allows body to store sugar, to convert more sugar into fat and so on. So if we restrict that, then the insulin response will be controlled. Right? And this is one of the ways that people who advocate ketogenic diet say, this is all you need to do. But they do not subscribe to the whole overall idea, because the ketogenic diet is not really about controlling calories, it's about controlling carbohydrate. Okay? But if you are taking all the other so-called, like in my view, not really healthy stuff, eventually, even though initially somebody can lose weight, eventually problems will still occur. So it is good overall to reduce our overall calorie intake, but this is in conjunction with looking at the intake of good fat, good oil, and also reduce overall, because at the end of the day, as I said earlier, we can't really store the excess carbohydrate and protein anyway. So it all boils down eventually to fat. So if we are able to control this, then okay, say intermittent fasting is very good for people to reduce the weight, and that will contribute to the cardiovascular health and so on. Right? So that will be good. But if, say, despite all this, there is no attention, don't care too much about what kind of oil and so on, I think eventually there will still be a problem, even though somebody can control weight and so on. I think that we said that, of course, there have been a lot of studies on the Mediterranean diet, right? As compared to other types of diet. Although the whole food plant-based diet is coming in now, and there's quite a lot of clinical evidence that is helpful. Now, the studies on Mediterranean diet, and that's been going on for such a long time, show that yes, if you follow this diet and the lifestyle and so on quite strictly, then the incidence of cardiovascular disease can be reduced by 30% or more, right? And they also found that not only the cardiovascular disease, but also the incidence of high blood pressure and so on, and the longevity of these people will be improved too. But of course, there has to be a change from the previous diet and lifestyle. So that's been proven by numerous studies. My emphasis has been on the diet, especially with the avoiding the damaged oil, right? But of course, there are other things as well. Of course, the most frequently quoted risk factor is smoking, right? So if somebody is still smoking, let's get off that as soon as possible. Because obviously, somebody smokes, then there will be a lot of stuff that's going into the system and that is causing damage to our cells and so on, right? So there have been a lot of studies on the effect of smoking, not just on cardiovascular disease, but on cancer and lots of other things as well, right? So to me, the diet is the most important, right? Then in terms of other things, there's smoking, and then controlling weight, which is part and parcel of the diet thing. And the next part is the physical part, in terms of being able to exercise and so on, right? So the recommendation here from the Health Association is at least 150 minutes per week, right? So 30 minutes a day of moderate exercise, at least brisk walking. It can be cycling, it can be swimming, it can be other things too. If it's vigorous exercise, then at least 25 minutes or 3 times, so 75 minutes per week. So the exercise part will be important to improve our cardiovascular fitness, right? So, but then again, as I said, at the end of the day, the diet is most important. If your system is damaged, your cells are not healthy, you can be physically fit, but the risk of getting heart disease is still there. I remember a little bit of history of one of my patients who appeared to be very fit. He could run up. When I was in state in Malaysia called Penang Hill, right? Which is I think about 1,500 feet. So this patient could run up. People just walk up. He could run up. But then when he came for assessment and so on, he was found to have really very severe coronary disease, and he had bypass operation. After that, he recovered well. So just mere cardiovascular fitness doesn't really protect people from heart disease if they have not done the basics correctly. That is, with the good diet to start with. Yeah, there have been some studies on the protective effect of omega-3 supplementations on how to do it. Now, the theory behind that is that there is supposed to be a disproportion, right, in the amount of omega-6 as opposed to omega-3. Now, a lot of the vegetable cooking oil in the Western market, including sunflower oil, corn oil, and soy oil, and so on, have high content of omega-6. Right? Omega-3, not so much. Right? So it's disproportionate. Right? So this kind of disproportion leads to inflammatory reaction inside the body. So that's in terms of leading to the inflammatory chemicals and so on, right? Prostaglandins and all kinds of things. Right? Whereas the omega-3 seems to have an anti-inflammatory effect, right? So that's one of the advocates for using 3 people with heart disease and so on. And there have been some studies that show a certain amount of protective effect from the omega-3, right? Now, I said that our body to function properly, we need to have omega-3 or omega-6, right? Because they form part of the cell structure. But there have to be a little bit of care here in terms of what the body needs. The body needs the natural, undamaged version, right? So there's a difference in the omega-3, which we get, say, from fish oil. In the natural environment, the natural form is there, right? But to extract the omega-3, to get it from whatever source it is, and to purify it, and then put it in capsule and so on, right? So this whole process can be damaging to the oil structure, right? So this is what we're talking about, in unstable situation with omega-3, right? So there is an issue, right, with omega-3 supplements because of the processing and how it's stored and so on. Right? Of course, it's not as bad as, say, oil or margarine, because the damage is already done. Right? So although there is some benefit from studies, nowadays I'm a little bit cautious in advising my patients to take this kind of supplement. And the supplement industry is a huge one, and we estimate that it is 4.5 trillion worldwide. So this is all the health industry. So in terms of supplements for the cardiovascular system, I would say most of them have a certain amount of benefit in terms of reducing the inflammation. Right? As I said, inflammation is a general term we use, right, to describe all these things that's going on. So because we have been exposed to all these bad diet, especially with regard to damaged oil, right, then there is always some degree of inflammation going on in the body. And studies have shown that most Americans, something like more than 60%, right, if you analyze them, right, they report there's a lot of inflammation going on in the body. Right? So in terms of the supplements, whether it's vitamins, C or E and all this stuff, right, they do benefit to some extent to reduce the amount of inflammation. Right? So this is where even when we think about whether the Mediterranean diet or the whole food plant-based diet, the increase in the intake of fresh fruits and vegetables, legumes, and so on would contribute to all this anyway. So this is another part of, like typical American diet. They don't really incorporate a lot of this fresh stuff into the diet, so they are lacking. So the diet itself would be helpful anyway, right? So that some people, unfortunately, because they're too far down the road in terms of the inflammation that's going on in the body, that need additional help. And for these people, maybe a certain amount of supplement would help. Now, still, I think that when we talk about inflammation, especially with regard to oil, is something I didn't mention earlier, because the polyunsaturated fat forms such an important part of our cell, and they remain in the system for a long time. So the half-life of oil in our body, half-life, you know what half-life is. So the half-life of oil in our body is 500 days, estimated, which means that whatever oil that's accumulated in the body has been there and will remain there for a long time. And this is where additional help. So is good. So unless you change diet, so go for Mediterranean diet or go for plant-based diet, then the system will get worse. So this would help. So I think that some people need additional help. So in addition to the healthy diet, okay, if they want to, they can still do it. But the most important part is still the diet. So we talk about oil, and I think that's the most important part, right? So we all accept that trans fat is bad news, right? So the one thing that everybody should avoid is, number one, margarine. Now, you agree that by definition, margarine is made from vegetable oil, right? If it's made from milk, it's called butter, right? So now, the say vegetable sunflower oil, because of the high content of polyunsaturated fat, and this sunflower oil will be omega-6, it can be omega-3, say canola oil. The complexity of the oil molecule means that this kind of oil remains liquid even when cold. Right? So you can do a little experiment for yourself, put a small dish of sunflower oil, say, in the freezer compartment of your fridge, it will not turn solid, right? So in order to turn this liquid oil into solid, you have to go through a manufacturing process which you call hydrogenation, right? So this is the manufacturing of margarine. Essentially, it is trying to turn the unsaturated fat into a more saturated version. It is essentially to straighten or flatten the molecule so that they can be packed closer together to become solid. Right? So by the time you get to the solid state, that is the margarine state, the damage is really bad already, right? And this is the first thing that everybody should avoid. Now, in years past, there was a brand which market sunflower oil as heart-friendly sunflower oil, right? So now you understand what I'm saying. That is the exact opposite of the real situation. Right? So margarine, whether it's made from sunflower oil, corn oil, all these vegetable oil, is the worst thing anybody can take. And we have to be a bit careful as well. When we talk about margarine, we can see it, right? Unfortunately, this kind of oil is incorporated in a lot of processed food, right? So it can be thin stuff and baked stuff, cookies and everything, right? So first, the margarine, avoid lighter plague, right? And secondly, the other oils, right? So this will include vegetable cooking oil, sunflower oil, corn oil, soya oil, and canola oil, right? Now, canola oil, some people advocate because it is high in omega-3, see? But unfortunately, omega-3 is still polyunsaturated, which is still unstable, right? So it can still be damaged, right? So if you're using omega-3 oil for cooking purposes, then it comes out with the same story. But the initial processing of the oil has already caused damage anyway. So any hydrogenated oil And why do people need to hydrogenate the oil? Hydrogenate the oil because to make it more stable. You see? So the process is damaging to the molecule, so it is bad stuff. So hydrogenated or partially hydrogenated oil is all not good. Right? So that part is very, very important, and more important than whether there's cholesterol or saturated fat in it or not. Right? So these are the things that they will be the most important. And then we come to the processing of food. Right? So the more processed the food is, potentially the worse it is. Right? So talk about having a drink. Can be processed drink or processed meat and so on. The more processing means that more stuff may be added, right? Or more damage occurs to the molecule, especially with regards to oil. Right? So reduce as much as possible the processed items in the food, go for more natural whole food as much as possible. Then added stuff, especially sugar, corn starch and so on, but all these sugar things, wouldn't be so good too. That would include even fruit juice. Even they say, like this is a pure fruit juice, but it's too good because the sugar content is very high. It wouldn't do a lot of good to our health. So these are the most important parts. Uric acid comes from essentially degradation of nucleic acid, right? So protein, especially, and this is where it's consumption of meat and internal organs and so on will have a value. And there may be an influence also on the intake of beans in some people believe, right? There will lead to slightly increased concentration of uric acid in the body, right? And as you said, uric acid can accumulate in various parts of the body, including the kidneys and then the joints, where they would induce inflammation in the body. And there's even some suggestions of increased uric acid may be one of the risk factors, in terms of cardiovascular disease. So in terms of the diet, I think that overall, if people can reduce the amount of animal products, meat and internal organs and so on, that would be one good approach. And in terms of the overall food, if they can increase the intake of whole food, like fresh fruits and vegetables and so on, then that would be overall good for them, and they would reduce the amount of uric acid that is produced in the body. So more fresh vegetables and fruits, right? And maybe a certain amount of beans, provided they're okay with it. It's very, very important, especially in this COVID situation around the world, right? It's lockdown and everything, like in Malaysia, it's still not great at the moment. So it is important, and not just for doctors, but also for the public. I recently been talking about how people's health actually is in their own hands, because it's all there, and then you can just go online and learn about all this stuff. Of course, unfortunately, there's a lot of misinformation as well online. So it is important that we get the right information to people, and especially the doctors also need to keep up to date, because unfortunately, a lot of doctors, when they've been practicing for a long time, they just hold on to the original idea. There's things that we learned years ago in medical school and so on. But we have to keep up with recent advances and improve our knowledge all along. So this is where, to me, it is a great time to disseminate this important information especially with regard to oil. Unfortunately, because maybe some people feel actually there isn't a lot of commercial, benefit from doing this thing. Not a lot of companies really want to get doing more of this thing. Now, even in terms of the COVID situation, all right, I didn't touch on it, but our immune system also depends on the integrity of our cells, right? So why is it such a big problem around the world, right? It's because our health situation is deteriorating, right? Especially with regard to our consumption of oil, and that we have damaged our immune system, and that's why when something comes out, like, this virus comes out, then we cannot defend ourselves, right? So in the long term, I think it is very, very important to improve our overall health and to wait for doctors and hospitals to take care of us. Maybe sometimes a bit late, like some time ago, a few months ago in India, but sometime in the now in Malaysia, people can't even get into hospital because it's so overflooded, So it is very, very important, and with this new technology that we can just online on Zoom and everything, that we can interact, disseminate this important and good information, medical personnel and public, and then it is wonderful that we are